Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Neurogenic bladder. What are my treatment options? Neurogenic bladder is caused by damage to the nerves that allow you to control the timing of urination. Treatments for neurogenic bladder can include physical therapy, medication, or interventional procedures. /r/n/r/n Neurogenic bladder causes varied symptoms, which can include bladder urgency, frequent urination, incontinence, the feeling of a full bladder, and urinary retention, not being able to empty the bladder. /r/n/r/n This article describes the causes, symptoms, and treatment of neurogenic bladder. /r/n/r/n Illustration by Mira Norian for Verywell Health /r/n/r/n Your treatment plan is guided by the underlying cause of nerve damage, your symptoms, the severity, and how your life is affected. /r/n/r/n Treatments may include /r/n/r/n You may need ongoing therapy with a combination of treatments. As your condition changes over time, you might need changes to your treatment plan. /r/n/r/n With neurogenic bladder, you can have a combination of overactive and underactive bladder symptoms. Urgency, frequency, and incontinence are sometimes described as overactive bladder symptoms, while a full bladder and urinary retention are symptoms of an underactive bladder. /r/n/r/n You might not specifically feel that a weak bladder causes the symptoms, but after you get a diagnosis, your healthcare providers will let you know which signs to look for. /r/n/r/n Symptoms of neurogenic bladder can include /r/n/r/n Complications of neurogenic bladder can cause additional symptoms, including /r/n/r/n In addition to these health complications, living with neurogenic bladder can cause stress, anxiety, or depression. Feeling like you could wet your pants in public or feeling that you always need to be near a toilet can limit your freedom, which can take an emotional toll and may affect your quality of life. /r/n/r/n Nocturia is getting up to pee during the night. This can cause disrupted sleep and fatigue in the morning. Sometimes, nocturia may result in wetting the bed. /r/n/r/n Urination involves your bladder and urethra, the tube that pee comes out of, which are coordinated by voluntary muscles that you consciously control and involuntary muscles that you do not control. Nerves control all of these muscles. You can develop neurogenic bladder if the nerves that stimulate your bladder muscles become damaged. /r/n/r/n Some nerves to the bladder allow you to hold your urine, and some allow you to pee. This is why neurogenic bladder can sometimes cause opposite symptoms. You might have incontinence, urgency, and retention due to the combination of nerves and muscles that are damaged. Bladder spasms can cause sudden leaking, and bladder weakness can make it difficult to pee. /r/n/r/n Medical disorders that can cause neurogenic bladder include /r/n/r/n Many of the same medical conditions can cause permanent damage or worsening effects. Multiple sclerosis is a chronic condition that can cause symptoms that sometimes worsen and sometimes improve. Some medications can cause neurogenic bladder, which should resolve once the medication is stopped. /r/n/r/n You may need to see a urologist or a neurologist, or both, for treatment of a neurogenic bladder that is not responding to standard treatment. A urologist is a physician specializing in treating kidney and bladder disease, while a neurologist is a physician specialized in treating conditions affecting the nervous system. /r/n/r/n A urologist will use diagnostic tests, postvoid residual, urodynamics, cystoscopy, to identify the specific problem that you're having and to help decide which treatments you need. /r/n/r/n Therapies for neurogenic bladder, with overactive symptoms, include /r/n/r/n It's important for you to know that neurogenic bladder requires treatment and evaluation by a medical professional. It is not safe to self-diagnose or self-treat neurogenic bladder. /r/n/r/n Nevertheless, some alternative and complementary remedies may help improve your urinary control. You should discuss these options with your urologist or other treating professional to know whether they are safe for you and whether you need professional guidance. /r/n/r/n Alternative remedies that may help people who have neurogenic bladder include /r/n/r/n These therapies may help you gain a better ability to sense and control your urination so that you can avoid accidents and complications. /r/n/r/n Living with neurogenic bladder can be challenging. You may experience urgency, incontinence, infections, and fluctuating symptoms. /r/n/r/n It's important for you to adjust your day-to-day life to maximize your comfort and independence while reducing the risk of complications. /r/n/r/n Lifestyle adjustments to consider include /r/n/r/n Pay attention to your symptoms so that you can discuss any concerns or changes with your healthcare provider. If your symptoms change over time, you may need adjustments in your treatment. /r/n/r/n Neurogenic bladder is a chronic condition that develops due to damage of the nerves that control urination. Causes for this condition include neuropathy, traumatic injury, multiple sclerosis, stroke, and more. /r/n/r/n You should not ignore any urinary problems you're experiencing because neurogenic bladder can cause complications when it is not treated. Effective treatment can help improve your symptoms, overall health, and quality of life. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.